Hi, my name's Sean Morton. I'm one of the senior lecturers in health and social care at the School of Health and Social Care at the University of Lincoln. I am also a nurse, and I've been nursing for 25 years, and now I currently teach nursing at the university. Recently I was asked to give a presentation on why there's a decline in men in nursing. And on looking at it, I realised there was a decline generally in people entering the nursing profession. But for the purposes of this, I just want to focus on why you guys should join the nursing profession. It's contrary to what the press may say or what the media may say. Nursing is a very, very admirable, good profession. And certainly with men in nursing, nursing is a tough profession. You need to be able to have the stamina to work all shifts. You need to be able to have the stamina to deal with different types of people. Not everybody you're going to come across is necessarily going to be nice to you. So actually you need the stamina to be able to cope with that. The other thing about men in nursing is I've found in my experience that people love you. People love nurses anyway, but actually certainly male nurses, they tend to love you even more. And I can remember many, many experiences where people really liked having me looking after them. It's not to say they don't like female nurses looking after them either. The other thing about nursing in general is that you have the opportunity to go into so many different areas of nursing. You don't just have to do bedside nursing, you can do management, research, teaching, but equally you can make a difference, you can make a change. And so if you want a profession that's going to help you make a change, then nursing is the right thing for you. Another thing, another key point is that sadly men in nursing is very, very low. It's typically hovering about 10% of the whole nursing profession. That's on the register as well as indicated on our nursing programs. And it's been like that for years. On my program when I started in the early 90s, we were about 10% of the nursing program. Men were 10% of the nursing program. And it's very sad when you see that medicine, for example, has 50%, at least 50% of their students are female. And I'd like to see men in nursing increase to those sorts of figures. Let's get more men in nursing and not stick around the 10%.